Cephalosporin is a big family containing 5 different generations, each of which has its own side effects, its own coverage, and its own features. But the whole class works the same way. It basically inhibits the synthesis of cell wall by binding to a penicillin binding protein, just like penicillin. This is what the protein is called of. So both penicillin and cephalosporins work on penicillin binding protein, this outer membrane protein. However, penicillin works by inhibiting the cross-linking of cell wall, while cephalosporins work by inhibiting the synthesis of cell wall. The cell wall is small fragments. The penicillin inhibits the cross-linking between these fragments and inhibiting the formation of cell wall. But cephalosporins inhibit the formation of these fragments in the first place. So both penicillin and cephalosporin work in penicillin binding protein, but they have different mechanisms of action. Now, cephalosporin, just like penicillin, is a beta-lactam antibiotic, which means that the main component of this antibiotic is called beta-lactam, which is kind of a sugary component. Now, the bacteria can produce an enzyme called beta-lactamase, which will destruct and destroy beta-lactam antibiotics, cephalosporins and penicillin. So the resistance mainly develops by overproduction of the bacterial beta-lactamase enzyme. The bacteria can also alter the shape of the bacterial penicillin binding protein, thus preventing cephalosporins from binding to this outer membrane protein. This will also develop as a resistance to penicillins. The renal tissues and parenchyma is sensitive to the sugary component found in penicillin and cephalosporin, the beta-lactam. So once beta-lactam enters the circulation, it will enter the kidneys, and this will cause kind of an allergic reaction in the kidneys. So once we take a sample of the kidneys, we will see a lot of neutrophils and lymphocytes. Basically the stuff that we would see in another allergic reaction. So the main side effects of beta-lactam antibiotics are hypersensitivity in the kidneys and nephrotoxicity with decreased GFR. Another very important side effect for cephalosporins specifically is disulfiram-like reaction. Disulfiram is a medication that we can use to prevent people from drinking alcohol. So alcoholics will have a lot of, basically they will be drinking alcohol all the time, and if the alcoholic patient take disulfiram, once they drink alcohol after taking disulfiram, they will have a lot of vomiting, a lot of abdominal pain, a lot of nausea. So they will stop taking alcohol because they know that disulfiram will cause these symptoms and side effects. This is called positive punishment. Cephalosporins have basically the same effect. If a patient takes cephalosporin and they drink alcohol afterwards, they will vomit endlessly and have abdominal pain and feel nauseous, and so basically the same thing as if they would take disulfiram. There are 2 more side effects that are not very common, but you might find them in the exam. There are vitamin K deficiency, so the patient will have less platelets and more bleeding, and hemolytic anemia. A good rule of thumb when discussing the generations of cephalosporin is that the more you go toward the 5th generation, the more gram-negative coverage you will have. And the more you go toward the 1st generation, the more gram-positive coverage you'll have. But that doesn't mean that 1st generation only treats gram-positive and 5th only treats gram-negative. All generations can treat all infections, but generally 5th generations do better with gram-negative and 1st generation do better with gram-positive, with 3rd generation in the middle being a good middle ground for both. Now here are the medications for the 1st generation, and these are mainly used as simple, minute or minor infections. So infections including E. coli, including Klebsiella and Proteus. So both gram-negative and gram-positive, but do better generally with gram-positive infections. It's unlikely that you'll find 1st generation indications in the exam, but if they would ask about an indication, will be upper respiratory tract infections. 1st generation is mainly used for treatment of upper respiratory tract infections, such as nasal infections, sinuses, and the larynx. So upper respiratory tract. And these are the medications of the 2nd generation. And unlike the 1st generation, you have to know the indications of when we used the 2nd gen. So we use them to treat gynecological infections, UTIs, and lower respiratory tract infections. So from the larynx down, basically the lungs and the pleural infections. 3rd gen is our favorite because it includes ceftriaxone and ceftazidime, and the whole 3rd gen can cross the blood-brain barrier, so they can be used to treat CNS infections. And this is the only generation that can do that. It's very important. Because the 3rd generation is in the middle, it can be used to treat many infections, pretty much anything from bone infections to Lyme disease to CNS infections to bacteremia and septicemia, just pretty much anything. Think of it as a generic antibiotic that we can use in the clinic for pretty much all patients. However, it does not cover serious and severe infections like MRSA, VRE, and Pseudomonas. For these serious infections, except for Pseudomonas, we can use the fourth gen, which are these medications. And finally, for the almost exclusively gram-negative, we use Ceftaroline, the fifth gen. The mainly covered organism is Enterococcus.